longer linger my class, I know that you are already exhausted because the series of you already attended a series of classes, already 3 consecutive classes. I think this is the 4th one. So I will no longer linger my lecture. I just only short key points. Key points will be here. Today's our topics is scabies, uh, scabies and superficial fungal infection and skin tumor. I'll shortly brief you about the key points because in lecture class we will elaborate discuss about this with showing pictures and elaborately. Now I'll shortly here the shortly key points because you are so exhausted. First of all, scabies. What is scabies? We know that scabies is a dermatological disease and it is caused by Sarcoptes scabies hominis, which is a mite, and it is a highly contagious disease. Highly contagious disease. It is commonly found in our country, especially where poor hygiene, who are in overcrowded, poor hygiene. These persons are low socioeconomic status, malnourished. These persons are usually affected by scabies, and it is a common dermatological disease in our country. So we have to know something about scabies. First of all, the causative organism of the scabies. What is causative organism? Sarcoptes scabies hominis. It is characterized by the clinical features. What will be clinical features? When a patient comes to you, then you will see there is papillovesicular eruption mainly, intensely pruritic vesicular eruption, a special site. What are the sites? Finger digits, finger waves, genital area, periumbilical region, lower abdomen, trunk. These are the common site of scabies. And as it is a highly contagious disease, so usually family members are affected. If a patient comes to you with scabies, just intensely pruritic vesicular eruption in the finger waves, also in the wrist, also in the genital area, lower abdomen, buttocks, these are the special sites. So then you will ask the patient whether any family member affected or not. If family members are affected, then you will be concluding to a diagnosis that it might be a case of scabies. And sign, what are the signs of scabies? Symptom, especially at a symptom, nocturnal pruritus. It is the common symptom. Nocturnal pruritus. Scabies রাতের বেলা কিন্তু চুলকানোটা খুব বেশি হয়। এই জন্য this is called nocturnal or nocturnal itching. And now sign is that there is a vesicular eruption in the facial site, that is finger waves, wrist, genital area, etc., periumbilical region, lower abdomen, also different areas of the body, but these are the sites of predilection. এখন হচ্ছে কি বা what are the sites? Signs is there is a barrow formation, vesicular eruption with a barrow formation. Now what is barrow? Barrow, it is a just tunnel. It is a tunnel with visibility in the inside the skin, but externally it is visible as a series of vesicular eruption in a linear way or in a curved way, a series of vesicular eruption. This is called and internally it is manifested by a tunnel. So this is called barrow. If a patient come with a barrow and vesicular eruption in the special sites with intense nocturnal pruritus, then we'll be think about the scabies. And with history of family member affected. Scabies. What is the treatment of scabies? We know benzoyl evolution. It is available in our government hospitals, also in Kojala health complexes and in sub-centers, in various health centers of in our country. Evolution. Another is permethrin pain. It is also available in our hospital. And another is 10% protamidon. lindane, etc. Widely used are Bivolution and permethrin. Permethrin, it is a commercially available Lorix, Scabies, these are so many names. Permethrin team, these are, and permethrin is 0.5%. It is used body topically. Bivolution is used always at least 3 consecutive days from the neck to whole body, including finger webs, except face and head neck. But in case of children below 2 years, you should apply the scabies lotion only. Scabies lotion is also head, neck and face. যদি 2 বছরের উপরে হয় তাহলে কিন্তু মাথা বা মুখমণ্ডলে আমরা স্ক্যাবিসের যে লোশন গুলা বিবিলোশন দেই আর পারমেথ্রিন এগুলা কিন্তু আমরা দিব না। আর যদি 2 বছরের নিচে হয় তাহলে কিন্তু আমাদের মাথা এবং ফেসেও কিন্তু আমাদের স্ক্যাবিসের লোশন গুলা দিতে হবে। যেমন আমরা বিবিলোশনই দেই, পারমেথ্রিন লোশনও দেই। যেমন বিবিলোশন যদি আমরা দেই তাহলে অলরেডি it should be given at least 3 consecutive days, first, second, third, 3 consecutive days, and without bathing. First day আমরা ফার্স্ট ডে প্রথম দিন আমরা গোসল করে ফেলবো, কিন্তু দেওয়ার পরে 3 দিন গোসল না করে থার্ড ডেতে আর 8 ঘন্টা পরে আমরা গোসল করতে পারি। দিস ইজ দ্য বিবিলোশন। At least on the other hand, permethrin, it is single application a day, and after 7 days another day. At least two times we given in a week, first day and after 7 days, and it is single day application. প্রথম দিন একবার দিব, দ্বিতীয় দিন একবার দিব, এবং একই নিয়ম। ওই যে ইয়ের সাথে যে নিয়মটা আছে, এই যে একদম ওই যে 2 বছরের উপরে যদি হয় তাহলে মাথা মুখ ইয়ে সহ, আর 2 বছরের নিচে যদি হয় তাহলে আমরা শুধু মাথা এবং মুখ ছাড়া সারা শরীরে। What are the complications of scabies? Can you say what will be the complications of scabies? Anybody? Can you say what are the complications of scabies?
Secondary bacterial infection.
Very good. Secondary bacterial infection, number 1. Number 2 হচ্ছে urticaria. It is also one. An important one is glomerulonephritis, because we know that scabies is always caused by streptococcal infection. Secondary bacterial infection always streptococcus also, but when streptococcal infection, then post-streptococcal glomerulonephritis, we know it will occur from scabies. And আমরা কিন্তু এটা অনেকেতেই পাই, এই যে মাঝে মাঝে আমরা কিন্তু আমাদের যে হসপিটালে বা ইয়েতে আমরা যে এজিএন বা পরে যে নেফ্রোটিক সিনড্রোম ডেভেলপ করে, এগুলা কেসে হিস্ট্রি নিলে দেখা গেছে বাচ্চাদের ক্ষেত্রে history of scabies. There are the history of scabies. So we should careful about the treatment of scabies. If delay in the treatment, or if it is a neglected one, then complication will easily happen. Now treatment. First of all, we know that there is secondary bacterial infection. So before starting treatment, we have to give a course of antibiotic to prevent the secondary bacterial infection. And a course of especially we can give fluoxacillin or flucloxacillin or cephalosporin or cefradin. This way you can give a 7 days course of antibiotic to control the secondary bacterial infection. And associated with there is the antihistamine. In case of children, we can give antihistamine syrup, and in case of adult, we can give so many different type of antihistamines are available in our hospitals, also in the market, and we can give according to age, sex, we can give any type of antihistamines to relieve the itching. And finally, we give after 7 days when the infection will subside, then we will give the specific scabies lotion. Either it may be bibilution or it may be permethrin. We know earlier I mentioned that in case of bibilution, it will given at least 3 consecutive days, And after 7 days, we repeat again 3 consecutive days, evolution. And then we wash all the clothing. যেগুলো আমরা সবসময় usually we usually use the clothes, also bed sheet, also our towel. These will all should be washed with soap water, especially warm soap water, because organisms will stay in our clothing. If we not wash properly, and so the scabies will return because it is a contagious disease. If we wear the contaminated clothes without washing properly with soap and warm water, then this may cause again scabies. This is the treatment. Now the scabies. Now we are going to superficial fungal infection, tinea. I will shortly brief because I know you are exhausted, and in lecture class we will details will give you with showing some pictures. So I now superficial fungal infection, that is dermatophytes. What are the superficial fungal infection? Superficial fungal infection are, we know, that is the name of tinea corporis, tinea cruris, tinea menam, tinea pedis, tinea facie. These are the types of superficial fungal infection according to site. We know that fungus is a microorganism. It has hyphae and spores, and it affects the most superficial layer in our skin. But superficial fungus. There is another type of the deep fungus. This will invade the subcutaneous tissue, muscles, and other different organs, lungs also. But in case of superficial fungal infection, there is systemic involvement is not occur, no any organ involvement or muscle involvement. There is only skin involvement and most superficial layer. We know that skin has a 5 layers: stratum corneum, stratum lucidum, stratum granulosum, stratum malpighi, and basal cell layer. These are 5 layers from above downwards. The most superficial outer layer is stratum corneum, and fungus also invade the most superficial layer, because the most superficial layer stratum corneum is consists of keratin. Keratin, it is a special type of protein, and the fungus, it is a fungus feed always keratin, and fungus lives on by eating keratin. So the fungus reside in the most superficial layer, and they also spread their infection through the most superficial. No invade inside most superficially, so gradually peripherally extension. In case of tinea corporis, what is tinea corporis? When superficial fungal infection occurs in the trunk, that is our chest, abdomen, or back of the trunk, the backside, then it is called tinea corporis. When it is occurs in the face, then it is called tinea facie. These names are actually was according to site of involvement. In face, it is tinea facie. In the skull, it is called tinea capitis. In the skull, if the lesion occurs, superficial fungal invade the skull, then it is called tinea capitis. If it is occurs in the face, it is called tinea facie. It occurs in the trunk, it is called tinea corporis. If the superficial fungal infection occurs in the inguinal region, then it is called tinea cruris. And it occurs in the hand, then it is called tinea menam. In the hand, it is called tinea menam. And it is in the, also occurs in the foot, sole or foot, then it is called tinea pedis. These are the types of. Now, what is the clinical picture of a superficial fungal infection? We know that superficial fungal infection has the characteristic features. If we clinically see a patient and on visible examination or naked eye examination, we can diagnose the superficial fungal infection, because the lesion always there is a well demarcated peripheral border, well demarcated centrally raised, well demarcated raised peripheral border, and that is centrally flattening central clearing. Center of the lesion is clear, and the periphery of the lesion is well demarcated and elevated edge. Just a like a ring shape. So it was also called ringworm. Ringworm because it is ring shape, ringworm. And if we do not treat properly, then or if we delay start the treatment, then the lesion will always spread peripherally. Gradually extension peripherally, the almost circular shape and gradual enlarge the circle of the lesion. So it is the typical picture of superficial fungal infection. Centrally flat and peripherally raised, well demarcated, active margin. This is the characteristic features of tinea corporis. If same type of lesion occurs in the face, then it is called tinea facie, and if these lesions also occurs in different parts of the body, the name also differ. Now, tinea capitis also we know that if the superficial fungal infection occurs in the scalp, then it is called tinea capitis. Tinea capitis also maybe sometimes secondary bacterial infection, just like scabies. Secondary bacterial infection, then there may be pus formation, there may be pustular, vesicular, or there may be ulceration. If secondary bacterial infection in case of scalp. Generally, in case of scalp, when fungal infection occurs, there are really secondary bacterial infection usually occurs. Then, so in case of treatment of tinea capitis, we have to give antifungal associated with antibiotic because here superficial secondary bacterial infection. So tinea capitis, tinea facie, tinea here. Now tinea pedis. Tinea pedis, it also occurs especially in the interdigital space of the toe. That is toe webs. The toe webs, there may be scaly lesion, dry scaly lesion, there may be moist, whitish, macerated lesion. There are so many types, but if we see in the, especially it occurs in the farmers or the fishermen who generally barefooted, and due to their occupation, the toe webs are always moist due to water contact, because the fishermen, the farmers are always busy with water. So this area is always affected by superficial fungal infection. We know that moist area is a favorable site for superficial fungal infection. There are some predisposing factors for infection of the superficial fungal infection. Number one is moist area, moist, excessive sweating, especially in the fold area, axilla, crown, finger webs, toe webs. These are the special signs. Another is anybody suffering from malnutrition. Another is anybody suffering from immunosuppressive disease, that is malignancy, or taking immunosuppressive drugs, or anybody suffering from diabetes mellitus. These are the or extreme age. In case of children, immunity is comparatively low, and in case of older men, there is immunity is low. So these are the risk factor for superficial fungal infection. Now, what will be the investigation of the fungal infection? The investigation is, we know that skin scraping for fungus and microscopic examination. Skin scraping for fungus and microscopic examination. If we যে lesion থাকবে, lesioner যে active border, it should be taken from the active border of the lesion, দিয়ে একটি গ্লাস স্লাইডে আমরা দিয়ে তারপরে এটাকে 10 to 20% পটাশিয়াম হাইড্রোক্সাইড দেই, 10 to 20% পটাশিয়াম হাইড্রোক্সাইড দেই। কপার সাইডে আমরা কি করব, ওই যে লিশন থেকে একটু স্কিন স্ক্র্যাপ করে কপার সাইডে দিব, দিয়ে ওইখানে 10 to 20% পটাশিয়াম হাইড্রোক্সাইড দিয়ে ওটাকে ডিজলভ করব, এবং ডিজলভ করলে যেটা হয় ক্যারাটিনটা ডিজলভ হয়ে যায় আর ফাঙ্গাসটা সেপারেট হয়ে যায়। তখন মাইক্রোস্কোপে it is will be visible under microscope fungus or hyphae. Fungus, hyphae or spore of the fungus. Hyphae will be seen at a branching points. The filamentous structure, tube-like structure, or branching structure, these are the hyphae. And spore, these are the rounded shape. Fungal hyphae or spores will be visible under microscope. and this will be the confirmative test of fungal. Skin scraping for fungus and microscopic examination. Another superficial fungal infection is nail. We know there are 20 nails in our body with finger and toenails, and these will be also affected by superficial fungal infection. If the nails are affected, what will be the clinical picture? We know the normal nail is there is a uniform, smooth nail plate, but if fungal infection occurs, then the nail plate will be brittle. There will be color change. What type of color change? They may be blackish pigmented, or maybe whitish pigmented, or they may be yellowish pigmented. And then the distal portion of the nail plate will be always brittle, and distal portion of the nail plate will already lost. If we see there are at least 3 points in a nail plate, we may suspect it is a tinea unguium or onychomycosis. So that is fungal infection of the superficial fungal infection of the nail. This term is called tinea unguium, or another term is onychomycosis. How will you diagnose? Clinically, the onychomycosis or tinea unguium, that if the there is 3 points, at least 3 points. Number one, if the color change occurs. Color change occurs means it may be whitish, maybe yellowish, or maybe blackish pigmented. Number one. Number two, consistency. If the consistency is brittle or fragile, it will go to favor of onychomycosis. And if the nail, the distal portion of the nail plate is lost, this is the another sign of fungal. If the 3 points present, you will confirm that it will be a superficial fungal infection of the nail, or tinea unguium or onychomycosis. Finally, we can go to the investigation, that is nail clipping. Here, earlier I said in case of tinea corporis or puris, there is skin scraping for fungus and microscopic examination. But now I told that in case of nail, there is nail clipping. Method is same. The infected portion of the nail, in a scalpel, we will, by friction, we take some portion into a covered slide, and then we give to 10 to 20% potassium hydroxide, and then it will be under microscope. We will see the fungal hyphae or spores. So we can easily diagnose a case of tinea unguium. Now, the treatment. In case of tinea corporis puris or tinea capitis or tinea unguium, all are treated by systemic antifungal treatment and local antifungal. What are the systemic antifungal treatment? We know, just remember the name of the drug. There is one is tricyclophilbin. Tricyclophilbin, it is in oral form. It is one of the common systemic drug of fungal infection, but nowadays it is not so widely used because it is not so available, and it is a fungistatic drug, not fungicidal. And another cause is there is side effects. There is headache, there is nausea, there is vomiting, and also there is hepatotoxicity. So, and as it is a narrow spectrum drug that is fungistatic, so we avoid tricyclophilbin. Now there is a broad spectrum fungicidal drug that is azole derivatives, which is fluconazole, and another also ketoconazole, ketoconazole, itraconazole, diaconazole. These are all are azole derivatives. These are highly active against fungal infection, superficial fungal infection, including skin, hair, and nail. And we also give the topical antifungal. This is also we know that ketoconazole cream available and miconazole cream available. So ketoconazole, miconazole, diaconazole, these are the topical cream for use locally at least 2 times in the particular affected area. These are the topical drugs. And we know that systemic antifungal, I earlier mentioned that there is one is azole derivatives and another is glycofulvin, and there is also some drug that is terbinafine. It is also a very highly active drug for, it is also another choice for any type of fungal infection, either it is a nail or hair or skin. It is effective against, and it is also available in tablet form orally and also in topical cream form. This may be also we can give. And recently, polycollagen, it is also another latest antifungal drug which is highly effective against fungal infection. This is also a oral form, tablet form. It is available in the market and you can take. All of the drugs I have mentioned, it should be given a single dose daily, at least 30 days. At least 30 days. Now, this is a brief about fungal infection. Now, I will shortly some key points about the skin tumor. Have you heard the name of skin tumor? Anybody? Have you heard the name of skin tumor? Anybody? Have you heard the name of skin tumor? No, because okay, there are so many types of skin tumor we know, but we within the most common skin tumor are one is basal cell carcinoma. It is the most common skin carcinoma. One is basal cell carcinoma. One is squamous cell carcinoma, and another is malignant melanoma. These three are the most common skin tumors in our body. One is basal cell, another is squamous cell carcinoma, another is malignant melanoma. Why it is called basal cell carcinoma? Because this tumor arises from the basal cell layer of the epidermis. So it is called basal cell carcinoma. Squamous cell carcinoma, it is the squamous cells epithelium of the body. So it is squamous cell carcinoma. And another is malignant melanoma. Malignant melanoma, this tumor arises from the melanocyte cells of the body. We know that there is a melanocyte in our body, in our skin, which is a pigment producing cells, melanocyte, and it contains the pigment melanin, and this is our complexion is depend on the melanin of the melanocyte, and these cells are responsible for our malignant melanoma. So we just remember the name of commonest skin cancer. There are three commonest: squamous cell carcinoma, basal cell carcinoma, and malignant melanoma. Okay. If any question from anybody, either scabies or superficial fungal infection or skin tumor, just if you would can remember the name of these commonest three skin tumors, this is sufficient. This is sufficient. But in later we we can see the some pictures in lecture class. In future, we have a plan. I have a plan to see you the some pictures about the malignant carcinoma of the skin. So it will be easy for you to remember this. Now, any question? Anybody, any question? Okay. So now, anybody, any question? No question? No question?